Negative pressure wound therapy, or NPWT, isn't used for every wound. Doctors select it carefully for certain conditions where it can make the biggest impact. Let's explore the main clinical indications. 1. Chronic wounds. Vacuum therapy is widely used in chronic wounds that refuse to heal with standard care. This includes diabetic foot ulcers, where poor circulation and infection slow recovery. Pressure ulcers, also known as bed sores, in patients who are immobile. Venous leg ulcers, caused by long-standing circulation problems. In all these cases, vacuum therapy helps clean the wound, fight infection, and stimulate new tissue growth. 2. Acute and traumatic wounds. Severe accidents, burns, or crush injuries often create large, complex wounds. Vacuum therapy is especially helpful in these cases because it removes fluid, reduces swelling, and creates the right environment for healing. It can be life-saving in preventing infection and supporting tissue recovery. 3. Post-surgical wounds. Sometimes, wounds from surgery fail to close as expected, especially in patients with diabetes, obesity, or infection. Vacuum therapy can support these surgical wounds by protecting them, reducing fluid buildup, and promoting faster recovery. 4. Skin grafts and flaps. Vacuum therapy is also used to secure skin grafts and flaps after reconstructive surgery. By applying gentle suction, it improves the contact between the graft and the underlying tissue, increasing the chances of graft survival and reducing complications. In summary, vacuum therapy is most often used for chronic wounds like diabetic ulcers, pressure sores, and venous ulcers, acute traumatic wounds, post-surgical wounds, grafts and flaps. For patients struggling with wounds that just won't heal, vacuum therapy can make the difference between long-term suffering and successful recovery. In our next episode, we'll share a patient journey, a real-life story of how NPWT transformed a non-healing wound into a healing success.